Medical emergencies. Diabetes mellitus. What is diabetes? It is an imbalance of glucose resulting from a deficiency or complete lack of insulin in the body. Glucose is the fuel that the brain uses, It's fuel for the brain that is manufactured from the foods that we eat. What is insulin? Insulin is produced in the pancreas, and it breaks down the sugar to provide fuel for the cells. There are 3 types of diabetes. Type 1 is insulin-dependent diabetes mellitus. Type 2 is non-insulin dependent, and type 3 is gestational diabetes. Type 1, insulin dependent. It's seen most often in the young, and it's also known as juvenile diabetes. This requires a daily injection of insulin. It's often associated with additional medical problems, and it has very abrupt onset of symptoms. Type 2, or non-insulin dependent, is seen most often in obese adults. It is also known as adult onset diabetes. It has a very slow progression with minimum or no symptoms. It's usually controlled with diet. Type 3, gestational diabetes, is related to pregnancy. Often the patient will return to normal after the baby is delivered. The chance of developing type 2, 10 or 15 years later, or postmenopausal. The exact cause is still unknown, but we can often refer to heredity. Type 1 is possibly a virus related to mumps, which may affect the pancreas. Type 2 also possibly would result from earlier gestational diabetes. Diabetic emergencies, hypoglycemia and hypoglycemia. Hypoglycemia is also called insulin shock. That occurs when too little glucose or too much insulin is in the bloodstream. It's a very rapid onset, and the causes can be skipped meals, not eating enough, insulin overdose, excessive exercise, a change in schedule, or emotional stress. Some of the signs and symptoms are cold sweat, skin that's pale and moist, drooling, very shallow respiration, a heart rate that is full and bounding, tremors and nervousness, hunger, irritability, confusion and weakness. The patient may be upset and refuse treatment. The treatment does consist of, if the patient is conscious, upright positioning. We can also administer carbohydrates orally, that is, giving the patient something sweet like ginger ale, sugar, candy, or orange juice. However, if the patient is unconscious, do not give any food or drink. Call 911. Place the patient in a supine position. Maintain the airway, perhaps even administer oxygen. The doctor may inject an epinephrine or a glucagon. Sometimes we can rub a frosting on the gums if that is available. Hyperglycemia. That's called a diabetic coma. That's caused from too much glucose or not enough insulin. It can be brought on by emotional stress, and it is slow occurring. Some of the signs and symptoms include increased thirst and urination, a loss of appetite, nausea and vomiting, fatigue, abdominal pains and general aches, dry, flushed skin, a weak and rapid pulse, a decreased blood pressure, a labored respiration, a fruity smelling breath. Without treatment, the patient can die. If the patient is conscious, we would give fluids without sugar if the patient can swallow, or we could have the patient self-administer insulin. If the patient is unconscious, call 911 to transport the patient to a medical facility. Do not give insulin. Provide basic life support. Additional medical problems can occur from diabetes, and they include blindness, slow healing of infections, kidney dysfunction, cerebrovascular accidents or strokes, high blood pressure. Some dental problems associated with diabetes mellitus include tooth decay and periodontal disease, fungal infections, taste impairment and dry mouth, which is also called xerostomia, trouble with healing. We may have to alter treatment if the patient is having medical issues. It's very important for the patient to have very good oral hygiene, and we might consider the possibility of an antibiotic premedication for these patients. Prevention. Check your medical history. Is this patient type 1? Type 2? Is it controlled diabetes? Consult with the physician before treatment. Keep the patient calm. Avoid scheduling an appointment that conflicts with meal time. Avoid long, stressful appointments. And a 2 to 3 month recare appointment for oral hygiene and periodontal conditions.